Slapped cheek syndrome, also known as fifth disease or erythema infectiosum, is a viral infection that primarily affects children. It is characterized by a distinctive rash and is caused by the parvovirus B19. Here's an overview of its causes, symptoms, transmission, diagnosis, treatment, and prevention. Causes: virus. The condition is caused by parvovirus B19, which is a small, non-enveloped virus that primarily infects humans. Age group. It predominantly affects children between the ages of 5 and 15, but can occur in individuals of any age. Symptoms. The symptoms of slapped cheek syndrome usually appear in stages. Initial symptoms 1 to 2 weeks after exposure. Mild fever, headache, sore throat, fatigue, mild cold-like symptoms, rash. First stage, a bright red rash appears on both cheeks, giving the appearance of being slapped. This is often the most recognizable feature. Second stage, a few days later, a lacy, reticular rash may develop on the trunk and limbs, which can be itchy. The rash often fades but can return with exposure to sunlight, heat, or stress. Duration. The rash typically lasts for several days to a couple of weeks, although it can persist longer in some cases. Transmission mode of spread. The virus spreads primarily through respiratory droplets when an infected person coughs or sneezes. It can also be transmitted through contact with infected blood or blood products. Contagious period. Individuals are most contagious before the rash appears. Once the rash is present, they are generally no longer contagious. Diagnosis. Medical history and symptoms. Diagnosis is often based on the appearance of the characteristic rash and the child's symptoms. Blood tests. In some cases, blood tests can be performed to detect antibodies to parvovirus B19, especially if the diagnosis is uncertain. Treatment. Symptomatic relief. There is no specific antiviral treatment for slapped cheek syndrome. Management focuses on relieving symptoms. Over-the-counter pain relievers such as acetaminophen or ibuprofen can be used to reduce fever and discomfort. Antihistamines may help relieve itching if present. Hydration. Ensuring the child stays well hydrated is essential. Prevention. Hygiene practices. Good hand hygiene, such as regular hand washing, can help reduce the spread of the virus. Avoid close contact. Keeping distance from infected individuals, especially during outbreaks, is advisable. Complications. While slapped cheek syndrome is generally mild and self-limiting in healthy children, it can lead to complications in certain groups, including pregnant women. Infection during pregnancy can lead to complications for the fetus, such as anemia or hydrocephalus, severe swelling. Individuals with anemia or immune compromise, those with underlying health issues, may experience more severe symptoms, as the virus can affect red blood cell production. Conclusion. Slapped cheek syndrome is a common and generally mild viral infection in children characterized by a distinct facial rash. While it is usually self-limiting, understanding the symptoms, transmission, and management can help parents care for their children and prevent complications. If there are concerns about symptoms or complications, consulting healthcare provider is always recommended.